Sarat Sabharwal. I'm a urologist from Peoria, Illinois. I am here in Cancun at the Galenia Hospital doing HIFU, which is high intensity focused ultrasound. I brought a patient from Peoria who is a young farmer who recently was found to have prostate cancer. He's extremely busy, and after long discussions and talking about complications, he elected to go with HIFU because of least amount of downtime and complications. He's a young guy, very well educated, and has chosen this treatment. So we both traveled together, and comforting to him is that his physician, his urologist, comes with him, and he's not in some foreign hands. So we will be here for 2 or 3 days. His treatment will be done, and he will recover and head back to the United States. I have been doing HIFU for about 3 to 4 years. I've had patients go back to work in as little as 5 days. Now that is not the norm, but the results have been quite incredible. And most of the patients that I've received are with just word of mouth.
Turning over the patient. Patient is asleep, and he's under the anesthetic. He is stable, and he is being monitored by anesthesiologist. And the planning phase of the treatment has begun. We have started now what's called a stacking procedure, where we're telling the machine where exactly to treat. Beauty of this treatment is we can absolutely treat what we want to treat and not damage what should not be damaged. So we can spare the nerves, the vessels, and the muscles. So once we have fine-tuned it, and then we are going to proceed with the treatment. So I describe this to my patients as this is a jeweler working with a chisel as opposed to an iron worker working with a sledgehammer. This is the chisel. We fine-tune the treatment as opposed to just hit it with a sledgehammer.
My name is Gail Newman, and my husband Mark is having this surgery today. We found out in early November that he had prostate cancer, and our doctor was Dr. Sabharwal, and he told him he had 3 options, and he mentioned the radiation, and he mentioned the robotic arm, maybe that was it, and then he mentioned the HIFU, which he mentioned as a $25,000 treatment. He just mentioned it being expensive and it not being done in the United States. My first thought was, well, you're not going to do that one. But after reflection, his comment was, well, of course I'm going to do that one. And after talking to his doctor more, and Mark's mind was made up probably from the get-go that this was the way to go. He just felt like the side effects were minimal, and I have to agree, after talking with this doctor, who I have the utmost respect for, and what I have read online, I just felt very comfortable with this decision, and I think we have felt that way ever since we've made our mind up.
We have treated the anterior and the middle zone, and now we're at the posterior zone. The treatment is going extremely well, just as planned, and we really haven't had any hiccups, so we're quite pleased. One of the nice things about HIFU is it allows you to treat, and then you can image the prostate again, and if there are any areas you're not happy with, you can retreat them. This is unique from any other treatment for any type of cancer. The procedure is finished. The patient is awake. He is being transferred back to the recovery room, which is where he started in with the same nurse, so he'll be very comfortable. Once he is awake and they're comfortable that he's doing well, he will be taken back to the hotel. The nurses will check in on him today, and then most likely he will have some dinner tonight and enjoy the evening with his wife. And he's told me that he's going to go for a walk on the beach tomorrow and have some breakfast. So that there concludes HIFU. I hope this helps you in sort of expecting what to expect, or knowing what to expect in your treatment.